Everyone happy we go ahead with this?
The operating theatre, a place of hope and fear.
A lot of people are really intimidated and really scared of coming into hospital.
I'm starting to freak out a little bit.
No, I love you, don't you?
Of course I do.
For the first time ever, an NHS day surgery unit and its staff have been rigged with cameras.
You've got a camera on your head.
I'm going to be filming you.
It's never a boring place to be.
Capturing a hard-working, close-knit team.
Welcome to our theatre.
Just had a birthday. Did you have cake?
Yeah.
Did you?
Yeah.
We'll get you back to the ward for a nice cup of tea.
Performing hundreds of complex operations every week.
I like fixing things.
Hey!
It gets your heart rate going.
Whoa, 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 whoa.
Can I have some help, please?
Changing patients' lives.
Stand clear, please.
Inside the operating theatre.
Look at that. That must be a world record.
So because you're having a general anaesthetic, there's some rules to follow afterwards.
Yeah, you do find that you repeat yourself a little bit.
Okay, so for 24 hours, you shouldn't drive a motor vehicle or any other vehicle.
Yep.
No operating machinery or home appliances.
You shouldn't operate machinery or home appliances, that includes a kettle.
Really?
So yeah, so you get 24 hours scot-free. You shouldn't be left alone without a responsible adult, and then we can insert the gag, or any adult, because we're just so funny.
We do hear the same jokes quite regularly, most often with, are you allergic to anything? And you'll hear either hospitals or the wife.
Hiya.
Owen.
What was the name, please?
James Wyatt. My kids are my absolute world, and not being able to participate in any of the activities that they want me to, it's gutting. Obviously my wife's being pregnant and we're expecting our third child. She can't really participate in any of the events either. How old am I?
You're 46.
46? 46?
It's been a bit of a drag really, because obviously my kids are now growing up and they're at the age where they want to run around and they want me to chase them. And I'm not able to do it at the minute, so I'm hoping that with the operation today that'll give me a bit of, freedom back.
42.
It's close enough. I'm hoping that it just makes my life a little bit more easy really, that I don't have to wake up and take painkillers and anti-inflammatories.
James Wyatt, please.
Hello.
What?
Are you coming through as well? Yeah, come this way. There you go, take a seat. Are you staying around?
Yeah.
Yeah, I'll go grab you a chair, all right.
James has brought the whole family with him. His wife Jordan, 4-year-old Imogen, and 5-year-old Lewis. Jordan is due in just 3 weeks' time.
I had to actually leave my previous job because I was lifting too much weight and it was actually causing me to have a lot of time off sick, and I didn't want that.
James injured himself 7 years ago.
Stop.
Your aeroplane.
Listen, stop being silly.
He tore the cartilage in his knee. In the last year, the pain has got significantly worse.
Just causes my knee to swell, and obviously with the adverse pressure on my knee, I can't bear weight or put pressure on it whilst it's swollen. It's painful to touch at the sides.
Do you know where we are?
No.
We're in hospital.
No.
Daddy's having his knee operation today.
No.
He is?
No.
Look, I'll show you. Look, sit here, look. What they're going to do is they're going to open my knee.
How do they do that?
They're going to take my knee off. Then they're going to use Iron Man suit.
No.
Yeah. That's what I'm going to do.
James Wyatt, he's in... Where is he?
He's down by the...
Orthopedic consultant Mr Subramanian will be repairing the torn cartilage in James's knee.
Can I just pop in, Adam? Make sure that it's not buy one, get one free here. So, plan is to put a telescope inside, have a look, Based on the MRI scan, we are suspecting that he has a meniscal tear, which is a cartilage tear on the inside of his knee. And if the telescope confirms the same, then we'll try to trim the torn portion and make it much more tidier and much more stable.
How long do you think I'll be off?
At least 3 to 4 weeks. 3 weeks definite, and then we can extend another 1 more week depending upon how well you recover. And second thing is you won't be able to drive for 3 to 4 weeks.
Not even if it's automatic? Use that 1 foot, can't it?
No, I know. I will see you shortly then. See you then, bye.
Take care, bye.
Now we're nervous.
No? Do you know what I'm nervous about?
Yeah.
The needle going in my hand. I'm actually more nervous about the cannula going in my hand than the actual operation itself. So I'm not a big fan of needles.
Oh, big boy here.
Right, James, they're ready for you.
Hello. Hi, I'm Nikki. I'm going to take you around to theatre.
All right.
All right. Then bye.
Why?
Bye.
Oh, look, we're right down here waiting for you.
Nice.
You lie down, relax yourself, nice and chill and relaxed, okay? And I'll just put a small drip in your hand. A sharp scratch coming on in a second.
God, I hate needles.
Oh, well done, you're doing really well. Well done.
Passion.
Oh.
Hello, day surgery. Rachel speaking. Can I help?
Hiya.
Hello, I've got an appointment.
You want a
Jonathan Beebe.
Lovely. Take a seat.
Thank you. I've had a chest problem all of my life. I was born with asthma. I was born prematurely. I was in and out of hospital for the first 4 years of my life. I get so tired now. I think it's because it's taken a hold. As a child, I couldn't play with my friends. I couldn't run. I'd get very tired very easily and things like that. And now as an adult, because I've been on so many steroids, you get muscle wastage. And as you can see, I'm quite thin and my muscles never build up.
Mr Beebe?
Yeah.
Would you like to come through, sir, please?
Over the last 6 months or so, I've had problems with coughs that haven't gone away.
I'm going to put you into bed number 5.
I hope from the operation that they'll find out what's wrong, that they will be able to treat it, and my life will be better for it. The best case is that it's just a bad chest infection. The worst case, obviously, would be cancer.
My name's Dave.
Hello.
I'm one of the nurses who's going to be helping to look after you today.
Jonathan has been brought to hospital by his partner, also called Jonathan.
It must get really confusing too, Jonathan.
Yeah, well, it happens.
Is Jonathan in? Well, which one would you like to speak to?
Yeah, well, yeah, that's it.
The couple met at a stately home over 10 years ago.
I went there to look round the house and the garden, and I met Jonathan in the dahlia bed, and he was deadheading. And being a gardener myself, I went over and had a word with him, and we got on really well, and it started from there.
I think I was in the dahlia beds. I think he'd come for a visit with someone, and we just started chatting, and couldn't get rid of him. He's a wonderful little fella.
When you come back from your procedure,
yeah,
you'll probably be nil by mouth for a minimum of at least an hour.
Oh, really? Oh,
okay, but the nurses will be informed of the time, and they'll let you know when you can start to eat and drink.
Okay.
He has to have this procedure because he's had so many infections and heaven knows what. Antibiotics don't do it. So they're going to find out what it is.
It's always useful to have.
Jonathan is here for an investigation of his lungs called a bronchoscopy. He'll have a camera inserted through his nostril and fluid samples taken. He'll be awake throughout. Theatre practitioner Alex has assisted on hundreds of bronchoscopies.
Having these kind of procedures is horrible, and you really, really feel for the people that are going through them. They're not pleasant, but they are necessary, unfortunately.
So you've got a bit of a waiting game now, I'm afraid.
Yeah, that's all right.
All right, cheers.
If it shows something really sinister, it will hopefully help Jonathan get the right treatment. It really does give life-saving answers.
James, your eyes are going to feel heavy now.
So you'll just drift off to sleep very, very soon. Think of something really nice.
Today potentially is going to be a life-changing operation.
I'm just going to give you a bit of oxygen to breathe, so take nice deep breaths.
If it relieves all my symptoms, means I'm going to be able to live a completely normal lifestyle.
James Wyatt is about to have an operation to repair the torn meniscus cartilage in his knee.
I'd just be able to do things that everyday parents could do that I currently can't. I'd be able to run, I'd be able to walk fast, I'd be able to carry heavy objects, I'd be able to just be a dad.
Before starting the surgery, a tourniquet is applied to James's leg to stop the blood flow.
So this gentleman is a 32-year-old gentleman. He was playing football 7 years ago, sustained injury to his left knee.
Mr Subramanian has 13 years of surgical experience.
His knee is constantly symptomatic in the form of pain, clicking and giving wave. So we are going to do a keyhole operation, which we call arthroscopy, to examine his knee. So we make a hole in the knee.
Lights down?
Yeah, please, thank you.
He inserts a camera with a light into James's knee.
So this is the inside of his knee. So we are looking his kneecap. So that's his meniscal tear, which has been there for almost more than 6-7 years. And in fact, his cartilage is quite badly damaged. When we inserted the scope, we found that his cartilage damage was far worse than what the MRI scan had shown. The fact that James has lived with this injury for 7 years is extraordinary. So here we go.
Oh, gosh. He's having a redo of circumcision. How can you redo one?
A bit painful, to say the least.
You've either took it off or you in. It's a bit weird, isn't it? Let's go investigate.
Jonathan Beebe is waiting for a bronchoscopy, which will establish if there is any sign of cancer in his lungs.
The quiz, we could do that.
Oh, yeah.
He knows it's an unpleasant procedure, so he and his partner are looking for distractions.
He will have something to do for half an hour.
Is your character real?
Yes.
Is your character American?
Not by birth.
Is your character said to be a hot guy?
Yes.
Has your character ever appeared in a Hitchcock movie?
Yes.
Oh.
Oh.
Cary Grant?
Yes.
Oh, well, I never. Yeah.
It's very clever, isn't it?
Yeah, it is.
How does it do that?
Jonathan has sort of devoted his life to helping others, I think. Not entirely intentionally, he just can't seem to help it. If he's ever ill, he will not be looked after. He gets up, he still goes to work most of the time. Yeah, she can't do anything for him.
Hello.
Hello there. Hi, my name's Alex.
Hello.
I'll be with you in theatre. This is Tiff here as well.
Hello, hello.
Is it okay if I pop a little cannula in the back of your hand? Is
Yes.
that okay?
Yeah.
Perfect. So what are we keeping you from?
Nothing.
Nothing?
Well, work.
Oh, what do you do?
I'm a gardener.
Oh, lovely.
You're outdoors quite a lot then, aren't you?
Yeah.
Yeah, not many people have gardens indoors, do they, I suppose? You melon.
No.
She's so mean to me.
Right, so I'm all prepped.
You
now.
are, you are.
Yeah, thank you.
Bronchoscopy is basically a camera on the end of a long thin scope which goes down so we can have a little look in the lungs. We either do this by inserting it down through the nose or in through the mouth.
So I'm happy to go if you're happy to go,
Yep,
Jonathan.
that's fine.
Right, let's go then, Jonathan.
Right, I'll see you later then.
In an hour.
And then we're just in this little room here, okay? It's a few people, but we're all here for you. Okay. Yep.
Yeah, pop yourself on the bed and get comfy.
Dr. Sheikh and Dr. Ahmed will perform the procedure.
Can we start?
Yes, please.
So, image.
Right. So, Bibi, my name is Ahmed.
Hello.
I am one of the other doctors.
Okay, yeah.
So I'm just going to do the procedure. Right, so this is just a local numbing agent that I'm going to spray the back of your throat with.
Okay.
So it doesn't taste very good, but it works well.
Okay.
Okay. Just say ah.
Tastes like bananas.
Yeah, lots of people say bananas.
So I'm going to give you some medication to calm you down, okay?
Okay, thank you.
So here comes a couple of gins.
Okay, lovely.
All right. How are you feeling?
I'm feeling all right, yeah.
The sedative will keep Jonathan as relaxed as possible, but will also stop him remembering all the details.
Okay. Just turn the light off, please. Okay, we'll see if we can. I think this one is extremely narrow.
Well done, sweetheart. You're doing brilliantly. Well done. You squeeze my hand. Well done. Well done.
You're doing excellent.
Lovely.
All right.
Brilliant.
Well done.
Take a nice deep breath. That's it.
Well done.
You're doing fantastically well.
The camera has to pass through Jonathan's vocal cords.
You're all right, my darling.
You're doing really, really well.
With the bronchoscopy, sometimes you have to abandon the procedure because the patient is not able to tolerate it at all. Sometimes the patient would fight the scope. Sometimes the oxygen levels go down. Sometimes the BP shot. So it feels like a race against time.
Try not to talk, my lovely. You're doing really well.
Just going to pop this oxygen in
It
your
might
nose,
feel like you
sweetheart.
can't breathe, but that's just the medication that we give you to numb your throat. You're doing really well.
You're doing brilliant. Okay, this is all normal. All right, you're doing so well.
Jonathan's had issues with his lungs right from the day he was born. He's lucky to be alive. If it weren't for steroids, he probably wouldn't have made it. The ideal outcome of this procedure is to see what he's got. They're hoping to find absolutely nothing today. That's why we come here, just to make sure there isn't anything.
Okay, so going down bronchus. Is that just a thick secretion, isn't it? Okay.
Do you want to take a picture now?
Yes, and then a better position there. This is the superior segment of the lower lobe.
Lower lobe, no.
Yeah.
This area looks like quite inflamed.
Saline is pumped in and then collected to be sent off for testing.
I'll go to the upper lobe now.
So you're not concerned about this area, are we?
That's why I was saying, wash it and see what's inside, if there is a tumor or anything.
So the rest of the lower lobe looks alright.
The scope has been inside Jonathan's lungs for 15 minutes.
Look at the left side now. Nearly done, sir.
Take a nice deep breath for me. That's it in the scope.
There we go. Brilliant.
Well done, Jonathan.
Well done.
sorry.
No, don't be silly. You've done brilliant. Well done. Well done. I'm just going to sit you up, okay? There we go.
Well done, Jonathan.
All over.
All done.
Well done.
Did you manage to do it?
We've managed to do it.
Oh, brilliant.
What we're going to do, we're going to get you through to the wake-up room, okay? Well done. You've done really, really well, okay?
Well, thank you.
Done really well.
Mummy,
Yeah.
what's sausage?
He's going to have his operation.
James Wyatt is having the torn meniscus cartilage in his knee repaired. Orthopedic consultant Mr Subramanian is performing the operation using keyhole surgery.
You are watching through the television and your hands are moving based on what you're watching. So it's a hand-eye coordination, that's what we say. The whole process takes easily more than 5 years to master this technique. So we are going to trim this torn portion so that his meniscus will be much more stable.
It's one of the most severe tears Mr Subramanian has seen.
The cartilage was completely ripped and ragged rather than a smooth appearance. So this instrument is called shaver. It will trim the edges and also it suck all the debris. So now you can see that after trimming, it's nice and smooth there, no unstable segment, but obviously he does have a inflammation of the synovium, which gives us seaweed-like projections.
The synovium is a thin layer of tissue which lines joints. This inflammation can also be trimmed away.
So we have done the procedure, we've done the meniscectomy, we are going to close the portal. So you can check that he has a good range of motion now, yeah?
It's taken just under an hour to repair James's knee. Patients generally spend half an hour in recovery, dealing with the after effects of the anaesthetic.
The operation's all done, James. James, you can wake up when you're ready. Can you open your mouth for me? You don't want to let go. That's it, lovely. Just going to sit you up a little bit. There you go. James, you've got a bit of the anaesthetic judders. Your bottom lip's shaking, so I'm just going to pop this oxygen mask on for a few minutes. Take some nice deep breaths of that, and that will help, okay? Probably around about 1 in 5 patients would get it, not every single patient. Our bodies all react differently to the anaesthetic drugs. but it's an involuntary shake. They can't stop themselves.
Cold.
Yeah, I'll get you another blanket too. The shaking happens because the body temperature can't regulate itself after a general anaesthetic. There you go, that should help. Gradually they just disappear by themselves. Right, that's that bit done. Is that your little boy down there?
It is, yeah, my little boy, my little girl. Hello. Oh, thanks.
Tell him you're ready for something to eat.
You
Have
are
a hot drink.
Star.
You take care.
Thank you very much. Bye-bye.
Bye.
Are you all right, James?
Yes.
Yes.
Well, I'll let you know in about 4 weeks' time, but yeah, for now I'm fine.
Well, I'm hoping you're not still going to be here in 4
No, I
weeks'
won't be here in
time.
4 weeks.
Daddy, what is that?
This is a magic device they put in Daddy's hand, because when I was inside there and that man was fixing Daddy's knee, I was Iron Man. I really was Iron Man. When I was through them white doors, I became Iron Man.
Well done. That was a successful surgery.
So 10 years ago, a majority of the procedures we perform, you'd have had to stay in. Now they walk in, they walk out.
The procedures we do now, you know, as long as you can get that patient comfortable and know they're going to be comfortable and well enough at home and don't need nursing care, we can do it, can't we?
Are you a tea or a coffee girl? You a coffee?
I'd love a strong coffee.
Grab the door, Richard, would you?
There's not a lot we can't do.
I used to be a medical secretary at this Queen Elizabeth Hospital for 23, 24 years, working for an eye surgeon. When I first started here, the day surgery wasn't built. I used to work in the main hospital building.
Good afternoon. Could I have Janet Crane, please?
It's me.
Hello, Janet. I'm Janet as well, so you
Ooh,
won't forget
boring
my
old name,
name.
isn't it? Yeah.
Have you done your hands with the gel?
No.
If you just have a quick squirt of the gel and I'll take you through.
I may see some people, I do know, yes. Possibly. Not 100% sure.
So, I'm just going to do your admission at the moment.
Right, hope. Oh, is this in the way?
Oh, you're fine.
Can I shove this on here?
Yeah, that's absolutely fine.
3 years ago, Jan was diagnosed with a cancerous growth on her face. When it was removed, it left a large hole in her nose, needing major reconstructive surgery.
They took a piece of cartilage from the back of the ear, inserted it into the nose, and then they had to have what is called a skin flap to make a skin graft. They cut through the forehead and brought the skin over to the tip of the nose. It was revolting for about 4 to 5 weeks, but it was well worth it because you're left then with a new nose.
These grueling surgeries were successful. However, when the area behind her ear started to heal, it produced a large scar called a keloid.
The keloid is at the back of my ear, just there.
Can I just have a look? How big is it?
It's quite big actually, it's getting bigger.
Sure, that's quite a big one. So
Yeah.
you may have some stitches in there.
Right.
So we'll let you know if there's anything to be taken out or whether they'll just dissolve. We'll tell you all that before you go home.
Lovely.
Jan is 63 and has been married for over 40 years.
We have no children. We are both very fortunate. We're both fit, healthy. We managed to take early retirement at 50. I'm a very keen keep fit addict. I try and keep as fit as much as possible. That's my key to life at the moment. Can I ask quickly, in case I forget to ask? You said today I can't do anything after, no exercise or anything today.
So obviously if you get hot and bothered, you know, everything just gets looser and your blood thins a little bit. It's probably not a good idea to go rushing around for 24 hours.
Right.
At the moment you are number 1 on the list, but the list can change. I just need to warn you of that.
Jan's surgeon is Miss Masood.
So the first lady is Janet Crane. She's a lady that has a keloid scar behind her ear. In Jan's case, she had become conscious of developing this lump or keloid scar behind her ear, and also because it was there because she had previous cancer, it was a constant reminder for her treatment that she had. It was important for us to treat it because we don't know how big it's going to get, because sometimes if you leave them they can get very, very big.
Miss Masood will surgically remove Jan's keloid scar under local anaesthetic.
Hello. Hiya. Brilliant.
We don't know why patients get keloid scars, but they are very, very difficult to treat. If you are prone to keloid scarring, it is highly likely to happen again.
There is the possibility that it will regrow even larger than it is currently.
Is that your signature there?
Yep.
Okay.
It's the risk I'm prepared to take.
So you're all ready to go. We'll see you in about half an hour or so. Okay. You're welcome.
It is unsightly. I am self-conscious of it, which is why I've started to grow my hair. And I want to go ahead and see if it can improve the appearance behind the back of my ear. Super. I shall be just glad when it's all over.
The reason why I became a surgeon, I'm very practically minded.
All done.
Lovely. And then we put our other screw in.
If I weren't a surgeon, I'd probably be an electrician or a plumber. I like doing things with my hands, so that's another profession where I could do that and probably earn a lot more money than what I do at the moment as a surgeon.
Scissors then, please. Thank you. My father was a surgeon, so being a typical teenager, I was pretty sure that wasn't what I wanted to do.
I wanted to be an astronaut, but I wasn't tall enough.
Miss Masood is treating Jan Crane, who's about to have a keloid scar removed from behind her ear.
Can the table go up a bit? So I'm just going to draw on you first.
Okay.
And I'll warn you just before I put the injection in. The injection is the worst part.
Okay.
It stings for about 30 seconds and it starts going numb.
Right.
Can I get you to turn your head that way, head that way? Okay. So this is a keloid. So sometimes when people heal, they kind of overheal.
Oh, right, so the body grows.
The body grows a lot more cells than it should really.
Okay.
All right, 1, 2, 3.
Squeeze away if you need to.
Well done. You're doing very well. You're quite active, aren't you?
Yes, very by the sound of it.
Yeah.
Not quite. And what's the thing you go to then, Alex?
Yeah.
Oh, you do body attack?
Yeah.
Whereabouts?
Yeah.
Do you do body attack?
Yeah, we're both in the same class.
Oh, fantastic. Okay, so that's the worst part over.
Cute.
It'll take a few minutes to fully kick in. You okay there?
Yep.
Feels like spa treatment so far.
Jonathan Beebe is recovering after a bronchoscopy, a test which will establish if it's cancer that's been causing his ongoing chest problems.
Hello. This is the lovely Claire. I'm Claire. I'm going to be looking after you for the next 20 minutes. So, okay?
Thank you.
Before we take you back to the ward.
Yeah.
All right, so I'm just going to pop this sign up, look, just so everyone's aware.
Yeah.
That you're not allowed to have a drink. Because you've had the spray down your throat, you know, you don't want to do that because you don't want you choking.
Can you put it on it, Guinness? After.
I'm afraid not. I'd love to, but is that what you like, is it, your Guinness?
Nice and cold.
My partner, he has Guinness, yeah.
Hello.
Hello.
Yeah. You're feeling okay now?
Yeah.
Better? Yeah.
I wasn't too bad.
Yeah, no, you were absolutely all right.
Yeah.
We took some sample from your right side of the lung.
Yeah.
It looked a bit inflamed, like some infection there.
Yeah.
So we took the sample and we'll send for further investigation. We'll culture it and we'll see what type of look like infection.
Yeah. Oh, that's good.
Okay, that's fine. All right, see you.
Yeah. Okay. Thank you.
Jan Crane is having a keloid scar removed.
Can you tell me whether you can feel any sharp?
It grew as a result of reconstructive surgery she had after being diagnosed with skin cancer. Having cut around the edge of the keloid, Miss Masood now needs to remove the lump at its root.
Are you feeling okay there?
Fine, thank you.
Great.
You're doing really well.
I'm getting rid of this slug. So the specimen or the keloid is out.
Perfect.
So I'll close everything up now.
Miss Masood seals and stitches the wound.
Can I have the steroids, please?
You've seen the outcome.
Yeah, I've seen it. Thanks. So I'm just popping the steroids in.
The steroids should stop the keloid from recurring.
That's great. Thank you. Thank you. Great. All done?
Thank you.
That should be enough. I think when people have had cancer and they've been treated for the cancer, the physical scars that remain can sometimes stop them from moving on. So for Jan, this surgery I'm hoping would help her move on from the memory of her cancer.
I was a little bit nervous about it because I thought the injections would be uncomfortable, but to be truthful, it all went very smoothly, very quickly. Okay to go?
Yes, absolutely fine. All
Thank
the
you.
best.
Bye. I'm glad I went through it. Whether it's going to be a success or not, I don't know, but time will tell whether it has worked long term or not.
Just warning, I'm not the greatest of drivers. So.
Oh dear.
Oh.
It's going to be a bit like bumper cars, is it?
Well, hopefully not that bad. But just keep your elbows in just in case.
Yeah. Oh dear.
Jonathan Beebe is ready to go back to the ward after a procedure to check the inside of his lungs for cancer.
Yeah, I'm all right, thank you. Yeah.
All right. That wasn't too bad, was it?
No, it's all fine, really.
Right, my lovely, take care. Nice to meet you.
Yeah, and you. No,
Hello.
Hello, little dozy one. Don't say anything if you can't.
I can talk a little bit. It wasn't very nice.
Oh. Oh. Oh.
All right. I wouldn't want to do it again.
No.
Jonathan's nil by mouth period is finally over.
Well, bless you, thank you. Thank you.
I think they give him something to eat and drink to make sure he can do it, and then I'll take him home and we can eat properly. He's vegan, which is perfectly all right by me, but today he's having chicken because I think he needs it.
I want a 4-course dinner now.
You are free to go home.
Lovely, thank you
All
very
right,
much.
congratulations.
Yes. Well, bless you all. You've been wonderful.
Don't forget your jacket, darling. Okay.
Thank you. Bye, bye. I am a bit wobbly, but...
James's knee has healed well. He gets occasional aches, but no more of the terrible pain. His new daughter, Ella Rose, was born 3 weeks after the operation. Jan is healing well after her operation to remove a large keloid scar from behind her ear. So far, there's no sign of it growing back. And Jonathan's results showed that he does not have lung cancer. However, he has been diagnosed with a fungal infection and is now on medication to try and clear it.